Fletcher's Solicitors are proud to sponsor the Mama Academy podcast series. We are one of the UK's leading birth injury specialists, trusted by families with the most complex legal cases. We champion better maternity care through every family's story. Fletcher's Solicitors, for every birth, for every baby, for every family. For more information about how we can help, visit www.fletchersolicitors.co.uk. Well, welcome to this edition of the Mama podcast. I'm Heidi Eldridge, the founder and CEO of Mama Academy, and your host today. And I'm here with Dr. Rebecca Moore to talk all about perinatal mental health, which is such an important topic. So, would you like to introduce yourself firstly to our listeners? Because I know you have so many different strings to your bow. And lots of expertise to tell us about. So let's find out all about you.
Oh, thanks, Heidi. So I'm a consultant perinatal psychiatrist. I'm based in London, and I have been a perinatal psychiatrist for a very long time. I was really lucky when I was a very junior doctor to work with someone who was very interested in perinatal psychiatry and really fell in love with it and have been working in this field ever since. Because for me, it's such a wonderful experience, such a privilege to walk with somebody through their pregnancy and postnatally. But at the same time, we also obviously know it's such a vulnerable period. So really wanting people to get that specialist care that they deserve. So I was working in the NHS for many, many years, but I now work privately. So I'm also one of the co-founders of Make Birth Better, and we are a collaborative of parents and professionals that work to try to reduce trauma within maternity systems, not only for women and birthing people and their partners, but also for staff working within maternity systems as well. And we do that via training, campaigning, research. And as you know, one of the big pieces of work we've been doing this year is around a collective of nearly 100 organisations where we have essentially written what we think needs to change and presented that as part of the maternity review that's going on at the moment with Baroness Amos. Also, I am a mum. Have experience of pregnancy loss. I also have had hyperemesis, so that definitely informs my practice and gives me, some lived experience as well to what people might be facing. And outside of all of that, I'm training to be a yoga teacher, and really, really love traveling. So that's me in a nutshell.
Gosh, that's so many things. Can I just say the Make Birth Better organization has just been fabulous. The work you're doing there is wonderful. We've been working alongside you now for quite some time, and we're obviously part of that collective, which is just fantastic. It's doing fabulous things. And yes, I cannot wait to see the outcomes of the report that we're going to be implementing, hopefully, and introducing to the whole maternity inquiry team. So that is really exciting, and it's been really refreshing to see so many people, so many organizations all
Yeah.
come together as a collaborative, working on that. It's really been something.
Yeah, it really has. And I think also the action is on practical change. Because I think, for so many of us that have been working in this field for a long time, people know what needs to change. We know the statistics, we know the risks, we know, how things can evolve. And often there's just reports reiterating the same thing. And I think one of the things that we really wanted to do was make sure that this was not just another report listing everything that was wrong. So it's very much focused on things that we can all achieve, which makes it really exciting as well.
Definitely, definitely. I wait to see the outcomes of that. And because there's so many of us, we'll make sure that it happens. We can hold people to account.
Yeah, Absolutely, absolutely. Great power in numbers, and just it's just been really wonderful because everyone's been so generous with their time and expertise, and it's just been a lovely thing to be part of.
Yeah, definitely. So, on the subject of mental health, there's lots of emotional adjustment that parents have to go through. What does sort of normal emotional adjustment look like? And when is it that midwives should start to get a little concerned, maybe, with what parents are going through?
Yeah. So, yeah, I mean, I think virtually everybody who's gone through that transition would say that your emotional health can be very up and down. And we know, of course, that there's certain things like baby blues, which are like hormonally linked, where everybody can kind of have a wobble in the first kind of week of being a new parent. And we can have those changes on and off, for a very long period of time. But I think for me, the biggest thing that midwives can look for is it being more than just a bad day. So we all know as parents that you have those bad days where you haven't slept, everything goes wrong, it just feels like a really difficult, awful day. But I think for midwives, what they can spot when things are perhaps evolving is that it's becoming every day or most of the day that people might be feeling they feel sad or tearful or very anxious or very overwhelmed. So it's about that kind of creep of it being not just a one-off, but becoming something that feels like it's every day. And that's often one of the really good initial things that midwives and health visitors, other professionals can look for. And it may sometimes be something that a person's family or partner have noticed. Sometimes people don't notice it themselves. So often, if people are going to see new mums in their home, it can be the people around them that have noticed something. So that can be really helpful as well.
And I'm just thinking, with the normal adjustments,
Mm.
we all go through that. I've just the next episode that comes out of the podcast, which is next week, I recorded an episode with Mum Love, and we talk about that transition, matrescence,
Yeah.
of going through not being a parent to becoming a parent and all the sort of normal emotions that you can feel during that. So that's also a really good sort of episode to listen to next week because it sort of explains those sorts of things. But today we're talking about real sort of mental health difficulties and that people can really struggle with. And I'm just wondering, is there sort of a particular group, say, of women and birthing people that might be of high risk of suffering mental health difficulties? Is there any particular circumstances that midwives should be more aware of?
Yeah. I mean, I think the first thing is to normalize that anybody can be impacted by their mental health. So, although there are certain groups that are more vulnerable, it can happen to all of us. It's really common. So, just to kind of normalize that and to make people know that lots of people have these kind of mental health changes. But there are certainly groups that are more vulnerable. So, clearly, if you've had a prior history, of any mental health condition in the past. So, if you've had depression in the past or anxiety in the past, if you have a family history, sometimes that can, things can run in families, particularly in the perinatal period. So, especially if you have a family member that has bipolar disorder. Um, then obviously all the vulnerabilities that affect mental health in general. So things like finances, housing, support, if there's been domestic violence, if there's drug or alcohol misuse, and then things specific to the pregnancy. So, if you've had a very difficult pregnancy for whatever reason, it might be after loss, or if you have hyperemesis, say, for example, and then it might be something about the birth as well. So if you've had a traumatic birth, if you are very sleep deprived, if you've had a physical birth injury, so you might be in pain as well. So you can see that there's kind of so many different things that can all impact. But yeah, definitely we would try to hold in mind all of those things and think, gosh, this person's got a lot of those things going on. So they might be somebody that needs more checking in with and more support.
I see. And as a society, we are very good at not talking, not wanting to talk about it, especially, different emotions and feelings. We can mask things sometimes. We might be a bit worried about what the outcome might be if we say something. How can midwives sort of pick up on these little signs, these little warning signs of a parent being in distress if they're sort of hiding it and masking it somewhat?
Yeah. So we know that lots of people, perinatally don't disclose how they're feeling because there is so much, stigma and fear, and people are afraid of being judged as not being good enough as a parent, and that can really
Mm.
stop people from speaking out. I just hear that from people all the time that they will say they weren't really honest about how they felt. I think a lot of it comes with midwives are really skilled at being with and talking to women and their families. And a lot of it is around giving space and time, which I know, can be part of the problem because people are so stretched. So, invariably, if you ask somebody in a very rushed situation how they are, they're just going to say, I'm fine.
Mm.
And what you need is time to kind of really explore with them about, tell me how it's been, how's your week been, was your birth how you expected it to be? Just really nice, open, gentle starters, not just diving straight in and saying, do you feel suicidal, say? Sometimes there's a way to do it which is very gentle and compassionate. And if you've built that trust with somebody, then they are able to start to talk about how they feel. So it really takes time. And obviously, the best case scenario is where somebody's had continuity of care with their midwife. So they know them and the midwife knows them and can maybe spot that they're not quite their normal self. But we know that often that doesn't happen for people. So I think for me, it's about giving time, giving space, and not being afraid to ask those questions. I think sometimes midwives feel nervous or anxious to ask those questions because they're worried about what will I do if somebody begins to disclose something. And that comes back to, training and how we support midwives to feel enabled to ask these questions because we should be checking in it as part of postnatal mental health, not just the physicality of it, but also just how people are feeling in general as well.
Mm. That's really interesting. So, do you have any sort of top tips on exactly how midwives can open up those conversations with parents so that they don't feel judged?
Yeah. So I think there's a big piece around normalizing, as I've said, how common it is for people to experience changes in their mental health. So just setting the scene by normalizing it and saying that this happens to lots of people, that, it's really common. I think being really clear about what your role is, that your role is to support. It's not to judge. It's not to make referrals to children's social care, because that's what everybody is worried about. It's to listen and think together about whether you need some support, whether we'll just monitor. So, really, that kind of compassion and kindness around it. And then just starting with those more general questions can be super helpful. So, asking people, how their week's been, getting a sense of what they've been able to do, and then, maybe checking, about how you're feeling in yourself, you can go down a whole route of different questions, but it all starts from giving time and allowing somebody to feel safe to kind of begin to talk about what they're feeling. And midwives can do that. Um, it's just that obviously I know so many of them are really battling, with time and pressure. And, these are not easy conversations to start. They can bring up a lot of anxiety on both sides. So
Mm.
it's really about making sure that people have got time to have these questions. And it's it's a practice really. The more you do it, the more comfortable you feel with doing it. And also, it really helps you to recognize that for most people, this is a milder, perhaps change. So not everybody is going to be at that very severe end, which I think is what midwives perhaps worry if they ask. So it's just a practice of doing it, over and over and then feeling more comfortable with it.
And if a midwife is concerns about what's going on, what are the first steps that they need to take in that moment?
So I think it depends on the concerns. Clearly, if you think it's an acute life-threatening risk, then, they would be going down the route of GP or A&E even or 111. If they're concerned, then I think it's always about sharing that concern. I really encourage people to trust their intuition. If there's something that has felt not right or you feel unsettled by, then speak to your team, your manager, speak if you have a local perinatal mental health team or maternal mental health service. Pick up the phone and just say, "Can I run this past you?" Nobody will ever mind being asked to do that. It's far better to check in and just talk it through with somebody than to leave it and feel, feel really concerned about it. So I think just check in with people, and I always encourage people, like, just pick up the phone, like, chat it through, let us think about it together. So I think that's the best first step, really.
Work as a team.
Yes, exactly. Yes. Yeah.
That makes complete sense. And from the family's perspective, what does sort of good, excellent, compassionate care look like when it comes to mental health?
Yeah. So many things, but I think, I hear all the time from people about it can feel so hard to navigate services, to know where to get help, to know where to start. So I think there is something about making services accessible. And then, of course, in the perinatal period, you want to get help to people quickly. So from a family's perspective, they want, a quick response, and they want to feel that they're with a team that feels inclusive and safe and can support them. And then, that can be about so many different things, about how we offer choice of where people are seen, about making sure there's interpreters, because we know that can be a big issue in terms of risk. And they want reliability. They want people to be consistent in how they see with them, meet with them, talk with them. And I think it also needs to be a sense of it being collaborative. So, it's not people telling you what to do, it's people sitting and taking the time to understand where you are at and what you are worried about. And then we think about what might be helpful or not. And it's also about a range of things that can be offered to people. So it's not just you can only have this. So increasingly, perinatal services offer such an amazing range of support. So it might be with a doctor, with a therapist, with a nursery nurse, with infant massage, with couple work. So it's about people knowing that there are so many different things that can help. And then they can think, I like the idea of that, that, and that. But it's really about somebody feeling safe. You need to, I feel, we have to work to earn people's trust.
Mm.
And that we need to be there when needed, and consistent and reliable and kind, so that people really feel held in this incredibly vulnerable time.
Absolutely. And I am actually astonished at the amount of different services there are available now. And I've spoken to lots of parents that have accessed these services more recently. And it's just wonderful because back in my day, which was actually quite a long time ago now, there wasn't anything. There wasn't these support services out
Yeah.
there. And there's so many available now, which is absolutely fantastic. And you don't have to wait that long to access them either, which is just wonderful. They can be found on the Mama Academy website. So on our website, we have a maternity directory, which is under resources. And then you could go to the mental health service section. Either midwives or parents can put in the postcode, and then you have a drop down field with all the local services. So that's available for midwives to use. And if a midwife is looking at it now and doesn't see their service, please do get in touch with me and we'll add it straight away, because I know lots of midwives are using that to signpost, which is obviously really helpful. And I'm just thinking, in terms of partners,
Yeah.
how can midwives sort of better support the birthing partners? Because I know they can sometimes be overlooked, and yet obviously they're equally affected as well.
Yeah. So I think this is one of the changes that is beginning to evolve and is going to continue to change, which is something that I've been talking about forever. Is really trying to make these services family focused, so that partners are a vital part of that. So there are some initiatives now that do involve partners. It's mainly dads, fathers at the moment. But things like Dad's Pad and specific supports for new fathers. Some perinatal services are now beginning to include and look at supporting partners as well as part of the offering that they give. It's not universal across the board as yet. But I think for midwives, they're in such a unique position if they're in someone's home doing a community visit and just checking in, if partners around to see how they are. And again, knowing what is available in your area so that if you're concerned, you can signpost them to that. Um, Pandas and Make Birth Better also did which is on their website, which you can download, which is a I need help document. And it's a list of symptoms, one for women and birthing people and one for partners, where you can kind of look and think about what might be happening for you and then use it to take to a GP or a health visitor. Because sometimes it's really hard for people to know what they're actually feeling because you're tired and your hormones are all over the place. And if you're a first time parent, like, is this normal? Is this not normal? So something like that can be really, really helpful. And I think particularly for partners, there's often a sense of, well, I haven't given birth, so I can't really complain. Or for men in particular, I have to be strong. And, they've often gone back to work very quickly. So they're not in contact with a lot of professionals because, most dads probably have only had 1 to 2 weeks off on paternity leave, and then they're not in the home when midwives are coming in. So I think it's just thinking about if there's any opportunity to catch a partner, just to check in with them as well. And that's why things like birth reflections meetings as well is often one of the only spaces where partners are there as well. So it can be another time just to check in with them.
Well, that resource sounds fantastic. And I assume that it's something that midwives could encourage, say, women and birthing people to look at, maybe print off, because that will give them the actual time and focus at home to really sort of think about how they're feeling. Because as a new parent, you're running around after the baby, everything's about the baby,
Yeah.
and you forget to take that time for you, don't you? So I guess that resource, they could hand that to their partner and get them to sit down and go through it. So where can they find that resource? Because that sounds fantastic.
It's just on the Pandas website under, you're going to test me now under which tab, but it's on the Pandas website. If I think it's under resources, it's free. You can print it out. I just think it's a really nice resource, and particularly because sometimes you can't really tease it out, but when you see it written down, you can think, oh, actually, I do feel a bit more anxious than normal, for example. And it's just a nice way to perhaps begin a conversation with your midwife. I've noticed this, this, and this. So yeah, please, I really encourage people to use it.
Absolutely. We've got some information on our website about sort of postnatal depression. and we're working with Mum Love to have some information just about the emotional change that we go through when transitioning to parents. So I will contact Pandas and see if we can put that resource on our website as well. Because yeah, I think that's invaluable. I think that's absolutely fantastic. What a great thing to do. So thank you for collaborating and producing that. Um, we touched upon escalation
Mhm.
a little while ago. So I'm just wondering, what are the sort of red flags that midwives really need to sort of look out for and act upon?
Yeah. So I guess there's three main groups really. I think if there has been an incredibly rapid change in someone's mental health, if there just, has been a change over hours into something that is completely different and new. So, if someone appears very high in mood or just isn't sleeping at all, or perhaps seems on edge or paranoid, that very, very quick change is one of the red flags that we would look for. The other would be if somebody is very acutely suicidal and is actually talking about it to a degree where they feel that has become an option, or if they're talking about specific plans around harming themselves, then that would be something that we would be really concerned about. The other would be if somebody was feeling very disconnected from the baby to a sort of very significant degree, or doubting themselves as a mum in a way that was very overwhelming and severe, or if they had any thoughts of harming the baby, then all of those we would say are red flag symptoms in a real emergency. So you need to seek immediate psychiatric specialist support.
And we covered another episode actually on postpartum psychosis. And so if midwives want to listen to that, it's available on our the Mama podcast. They can go and listen to that as well because we have covered that. What are the sort of common symptoms of when mental health is getting worse? What should midwives be looking out for?
Yeah. So if I break it into the commonest things that perhaps women would experience, so, there would be, if you look at depression, anxiety, perhaps after a traumatic birth, would be the biggest changes for people usually. So with depression, you would be really looking for somebody to be feeling like their mood had changed. They just felt might be more tearful, felt flat, just not looking forward to things, not enjoying things, like not wanting to get up, feeling really tired. And then there can be changes in appetite and sleep as well. So those would be more the kind of depression type things that might evolve. With anxiety, it's a sort of really horrible, constant sense of feeling on edge and worried. And sometimes that's linked to a specific thing, like socially or going out. But sometimes it's just this horrible sense of feeling on edge and restless and worried that you can't quite see why. And again, with that, you can get changes to sleep. It can often, people find it harder to eat, and just can be really tiring when you feel like that all the time, just on high alert. If there's been a perinatal trauma or a challenging birth, a traumatic birth, then people might be replaying the birth over and over again, like either in the dreams or in their thoughts, just can't stop thinking about it all the time. Or also might be not wanting to talk about their birth at all, not wanting to go to mother and baby groups and be asked about their birth, and also feeling on edge, irritable, angry, jumpy. And then I guess the final group would perhaps be where there might be OCD, obsessive compulsive type pattern. And that can be where people have a lot of very intrusive thoughts or images that something is going to go wrong. And so to stop that happening, they might be cleaning all the time or hand washing all the time or checking baby all the time. And of course, somebody could have a whole mishmash of any or all of those things, but those are probably the commonest things that might start to change. So again, for a midwife, if you spot any of those, it's always worth exploring it in a bit more detail and trying to kind of map out which mix of symptoms people might be having.
That's really helpful. Thank you. And what would you say to any midwives that are particularly worried or a little bit anxious about getting it wrong? What would you say to them? Because I know some would fear that they might be overreacting sometimes.
Yeah. So I would say that don't be worried about getting it wrong, and the fact that you're worried makes me know that you're a good midwife. Because if you weren't worried, you'd just be asking questions without thinking about it. So I think there's lots of things, that midwives can do is if you do feel like, oh, this feels like a bit of a gap in my abilities, or I feel not confident about this, think there are so many amazing free resources, trainings, podcasts like this. Learn a bit more about it, and then hopefully you will feel confident. The other thing is that you can very rarely ask something in such a terrible way to somebody that it causes harm. So, for example, with suicide, asking about suicide does not increase the risk of suicide. It's far more important to ask than not. So, don't be worried about getting it wrong, because most of the cases where things do go catastrophically wrong is where people haven't asked. So even if you feel like I'm not sure I'm doing this exactly right, or if something is niggling at you, it's always worth asking. And again, go back to your team. If you have concerns, run it past them. It can all be a learning experience of, how I asked, some I've done differently. Somebody says, I've found this is really helpful. But I think don't ever feel worried to ask. We don't ask enough still, even with all the amazing advances that have happened that we've spoken about. There are still gaps where people don't get asked, and I think we need to be doing that consistently for everybody, and that's in pregnancy as well as postnatally.
It's better to be safe than sorry.
Absolutely, yeah, yeah.
And this obviously has a huge emotional load on the midwives themselves. What impact can it have on their own mental health, and what can they do to protect their own well-being?
Yeah. Yeah, so we know how tough a role midwifery is. I think they're unbelievably amazing and working hard under really high pressured work constantly. So I think there are different layers of things that should be in place. We can talk, all day about self-care and things that we can do for ourselves, but really I feel that that's missing the bigger part of the picture is about how does the NHS care for its midwifery teams, or it might be that the independent midwives is outside of the NHS. And that's the big missing picture, really, is that for most people working within the NHS, they have amazing peer support from their colleagues and teams, but they aren't getting the consistent emotional resourcing included in their working week that they should be having. So that means, for example, making sure that every shift is adequately staffed, making sure that everybody has a lunch break, making sure that everybody has a named person that they can go to and talk to if they need to. And also that there is formal debriefing. So somebody comes in and sits with the team and helps them to process, perhaps where there's been a stillbirth the last week or something very traumatic and difficult has happened on the unit. And that's what's missing for most people, is that the onus is too much on what are you doing to keep well yourself, which of course is important, but it has to be both. So you can't continue to work in a environment that's incredibly toxic and stressful and damaging. You can be so well resourced, but nobody can thrive in that long term, which is why, we have such an issue with people leaving midwifery. So that's the part that really needs to change. And again, that's something that we've flagged and highlighted in the collective piece. But also, there are self-care things that you can do for yourself. I'm always really mindful of, because everybody's idea of self-care is completely different. So it's just thinking about those moments that kind of lift you and resource you. And sometimes that will be outside of work. Sometimes it might be 2 minutes in work where you just sit and have a cup of tea with a colleague. So it's about both of those things, but it's the bigger systemic piece within the NHS is really missing still.
If you some of those things aren't happening, or perhaps, they used to happen, but they're not quite happening anymore. How can you try and change that? How can you raise that as an issue? Because obviously it's so important for staff retention.
Yeah.
How can you do that? Who would you speak to, and do you have any tips on how to start that conversation?
Yeah. So, I must say some teams do it amazingly well.
Yes.
Really, really good to see. But we just know that it's not equitable across all teams. I think you have to frankly be irritating and annoying. And, you have to take it to your managers and build the case for why the team needs it. Because in reality, these things are very easy to integrate and they lead to the staff feeling supported, good team well-being, less sickness absence, less people leaving. So you just need to keep lobbying for it locally, with your managers, with commissioners, to build the case as to why it really, really matters. Um, I'm afraid there's nothing more kind of, than just keeping on, keeping on asking for it, and you can use the collective plan because we have a whole section on that and why it's needed and what should be in place. So it goes into all the details of what is actually needed. So, that is accessible. You can print it out. You can take it to, whoever's looking at that within your trust, and that it's all there for them as to what is actually needed.
Yes, so it's evidence-based research. So go in armed and possibly, look at another trust that has a really good model that is doing it well.
Mm.
Speak to them, find out, how they run the shifts, how they incorporate certain lunch breaks, etc.
Yeah.
And then take them to the managers and say, this is the model of care that, is working in other trusts. Can we try and implement something similar?
Yeah, absolutely. The peer support piece is absolutely invaluable, and that is often what's missing. And we're just launching that at Make Birth Better, which we're super excited about. But that's what people really need is that space that is not on a day off. So they have to come in. It's built into their working week where you get a space to decompress and to talk about how you're doing and how you're feeling. Because when you have that, you then have midwives going out fully resourced, being able to give that compassionate care to women. So you get this whole kind of flow of how it should be working. Where when you don't have that, we know that there's huge issues with kind of burnout and compassion fatigue. And then you get that where women feel they're being cared for in a way that's not quite ideal. So it's such an easy thing to solve. It just needs that kind of planning around it.
Absolutely. So, if you could give one piece of advice to help midwives care for their patients, but also for themselves, what would it be?
Gosh, that's a really, really difficult question. So I'll split it. I'm going to cheat and split it into two. So I think, caring for women is just, like I've said, it all comes back to that sense of safety. So, making women feel heard and seen. So we know that so many issues in, mental health, women's mental health, trauma stem from people feeling they're not being heard. So, making sure that you provide time and space to really listen and sit and be with that person, which is, the essence of midwifery. And then I think for yourself, really, as we've just been discussing, push for your health to be given time and space within your working week from work so that the onus is not just on you to constantly look after yourself. So you need both of those things together. And also just generally know that you're doing an amazing job. I just think that there are so many amazing examples of midwifery care within mental health that often don't get, focused on or talked about enough, how hard midwives work to support people. And there are so many amazing new midwifery roles where, you have a lead for all kinds of different vulnerabilities that is really giving people bespoke care. That I think we just don't kind of highlight, the amazing work day in, day out enough.
Absolutely. No, I completely agree with that. And what's the one thing you wish every maternity professional knew specifically about mental health that could really change outcomes instantly?
Yeah. I think it's what we've come back to talking a lot about is that it is really common. And if we ask questions soon enough, we have such a potential to stop things progressing. So, women's mental health in the perinatal period can deteriorate so quickly and become so severe. But also, people get really well really quickly with the right support. So, I think the sooner we can ask those sensitive questions and maybe pick up something emerging, then the better it is for everyone, not just mum, but also for baby, for future pregnancies. So, asking questions as soon as you have that niggle, I'm not quite sure what might be changing here, is has such a potential to cause such huge change.
Act quickly,
Yes, if you can, please.
quickly as well. So that's why I guess the checking in is quite important.
Yeah, yeah.
Well, that's so helpful. Thank you so much for spending time with us today. How can people find you on social media, find out more about the amazing work that Make Birth Better is doing?
Yeah. So I'm mainly on Instagram, just at Dr. Rebecca Moore. Also, Make Birth Better is on Instagram, and you can also look at our website, which will pop up if you type it into Google. But we have a load of free resources there for both parents and professionals. We have some free training around perinatal trauma. So lots and lots of free resources there, which, we'd love people to access and look at.
Wonderful. Well, I really look forward to continue working with you
Brilliant.
because it's such a fantastic organization. And yeah, you've done so well. It's grown beyond belief over the last few years, I'd say. And yeah, I'm just really looking forward to what more we're going to achieve together.
Yeah, absolutely. It's really exciting. Just so many things that we're thinking of and planning, and I know you're always doing the same. So, but I think it's if I look back at when I started perinatal mental health, which is in late 1990s. Although, excuse me, we have ways to go. There are some areas of the country that are still not as well resourced. In terms of where we were and where we are, is a really wonderful thing to look at and see. And I'm really hopeful that we will just continue to offer more and more bespoke care for people, so that everybody feels they can access services when they need them and get that support.
Absolutely. We have come a long way. Like I said earlier, the amount of services that we have available now and the fact that we talk about it so much more, we're so much more aware of it. It's fantastic. So thank you so much for all the work that you do, and keep going.
Thank you.
Fletcher Solicitors are proud to support the Mama Academy by sponsoring this podcast series. At Fletcher Solicitors, we champion better maternity care. For every birth, for every baby, for every family.
If you enjoyed listening to this episode, share it with a friend or colleague. Make sure you follow us so you don't miss out on our next episode. If you'd like to support our work by fundraising or volunteering, please email contact@mamaacademy.org.uk. For more information on pregnancy and maternity services, please visit our website at www.mamaacademy.org.uk. We're also on all of your favourite social media channels. See you next time!